Thank you guys for already joining me up here. I appreciate it. I'm going to introduce them in just a minute. I want to first thank Sean for his aspirational talk. That's the second time I've been able to hear him speak in person, and he somehow seems to calm my anxiety about the fact that this technology is really outpacing our policy. And I'm the kind of guy who just earlier this afternoon walked down to the record shop and bought my vinyl. So I'm waiting on the rebound from the AI back to the vinyl. So thanks Sean for his aspirational look at this. I want to first introduce our panelists in this panel for Pushing Boundaries, the Way Forward in Arkansas Health. First up, we have here a known face. Ryan Cork is the Executive Director of the Healthcare Transformation Division of the Northwest Arkansas Council. His vision is one where all members of the Northwest Arkansas community have access to world-class healthcare. And before moving to Bentonville, he worked in strategy and finance for healthcare operations in academic, domestic, international, and military settings. Please welcome Ryan.
Thank you, Swart.
I'm all in favor of applause. So. All right, next up we have Sarah Goforth. She's the Executive Director of the Office of Entrepreneurship and Innovation at the University of Arkansas, overseeing the team responsible for innovation and entrepreneurship programs for facilities and students, faculty and alumni of the university. She's also adjunct professor in the Strategy, Entrepreneurship, and Venture Innovation Department in the Walton School of Business. Please welcome Dr. Goforth. Next up on the end, because you're up in my list, Carol Silva Moralez is president and CEO of Upskill NWA, a workforce development program providing low-income wage earners with access to higher wage, high-demand jobs in healthcare through education and certification assistance. She began her career at Walmart, working in multiple leadership roles over 25 years, and she serves as the vice president on Community Clinic's board of directors. My good friend Judd Simmons. Give her a hand. Last but not least, Mr. Zak Morris. He's the co-founder of Triton Studios, an innovation and tech agency that is driving a new age of AI-augmented ways of living and working. Based in Northwest Arkansas and Tulsa, Triton is focused on crucial sectors including healthcare, education, and energy. Previously, he worked as a cybersecurity risk expert at Walmart addressing enterprise-level security challenges. Please welcome Zak. All right. Before I jump in with my first question, and I do want this to really feel like it's kind of a response to what Sean had to tell us, I want to remind us of some of the things that he said. Second-order effects will transform sectors. AI's fuel is data, which I love. Harvesting that data and organizing it and redeploying it is key. We'll see unbundling of services. AI makes predictions, and it does so inexpensively. He saw that we would expand the definition of wellness, and I would extend that into the medicalization of social services. And the one thing that really caught me, again, even though he eases my anxiety, he says, if we do it right. And so you guys are going to let us know how to do it right? All right.
No pressure.
So first question, and this is open to anybody, all right? Is there something that Sean said that stands out to you or shocked you?
I'll take it. I think, and thank you, Sean, for being here and presenting. Thank you, Dr. Thompson and ACI for having us. I don't know that it shocked, but I think his number one point, the data of healthcare, allows us to make these decisions, right, and put these algorithms together for what we're going to do. I mean, AI. You gave Zak's title. I don't even know what that means, right? Like AI is a lot for a lot of people, and we need to better understand that and what we're doing with data. And so having that data and being able to translate it and transfer it into what this actually means for me. And so if I'm speaking to someone with a 6th grade education, I communicate that to he or she. But if I'm speaking to someone with a PhD, right, it's the same. And so having that data absolutely is the way to go. But what we do with that specific data and how we translate that and storytell that and how it helps design our flows and operations in our healthcare system, I think is very important.
Yeah.
Yeah, I would add, so at Upskill NWA, you have a mission to connect everyone to their dream career. It happens to be in healthcare. So we take non-traditional students and we pay for them to go to school, provide them with a career navigator that coaches and mentors them and then helps place them in a job, a high-wage job right here in Northwest Arkansas, one of the 5 hospital systems that happen to be our partners. So my perspective is coming from the individual that's preparing to go into the workforce. So there's what's happening right now in the workforce. And we have telehealth, and I am somebody who has experienced a telehealth visit during COVID for me or my children, so I've certainly benefited from those things. But as I think about the participants who are currently in school, I worry about their preparedness to use technology, to know enough about it, that they're equipped to be the best healthcare providers they can be. And whether that's at our community clinics or that's the recent graduates that's working at Arkansas Children's with Shannon over there. I am worried about our educators' ability to keep up with those things so that they can be the best healthcare providers they can be.
And so go into that a little deeper, because with Upskill, you are taking people who are currently in the industry and training them up, right? So,
or we're taking the Hobby Lobby counter worker that wants to pursue healthcare because maybe mom or dad received really great care from a cancer nurse. So, I mean, those are real participants that come. So they may have 0 healthcare background. And technology might be even more limited than that. I think the reality, as we look at the state of Arkansas, where we still have rural communities that don't have access to Wi-Fi, so their kids are having to be in the schoolyard to be able, I mean, we saw these pictures during COVID. I am concerned on a number of fronts with our ability to keep up with what we know is coming. There's these external forces, like you were saying. There's a lot of work we all need to do together.
Yeah. So I'll blend a bit of kind of where Sean left off and kind of what she's speaking to. So it was just kind of a fun serendipitous moment of talking about the chess player being beaten at a certain year. And I'll actually take that metaphor with something that I kind of did for myself to understand a couple of years ago, like, where's this going? Fast forward to 2011, and that's when we had a Jeopardy champion beat by AI. This is different because, this is a human file cabinet of context that can also do it real fast. And that was when we kind of go, so that's new. It's not just a predetermined number of possible moves and it's getting there faster than someone can think of it. It's looking at human context and meaning, understanding the question, and then beating the fastest human that's done it a lot. And that was in 2011. So to start understanding some of like the potential here and where is this going and how can I see this? I'm exceedingly visual, sometimes to a fault. Because I actually more identify as an artist than anything. Hello, cool shirt. So I was like, how do I see this though? And I looked at compute as my kind of base unit of possible potential. It's kind of how fast can something think of a thing. And in 2011, which is where we had a Jeopardy champion beat, that was where I turned it into a sphere. That would be the equivalent of the moon. There was a lot of zeros on these numbers for speeds, and I was like, I don't know what that means. So I turned it into a sphere. And with 2011 being the moon, fast forward to 2020, and that's the Earth. Even though it probably hasn't felt like Earth since then, but 2020 would be the Earth. That's when AlphaFold was able to solve a 50-year-old protein folding problem. Fast forward just 3 years, and we've gone from Earth to Neptune. Here we are with commoditized, two-way conversation AI. right? Where now conversation is code, which means conversation equals creation. And that's getting pretty interesting pretty quick. Go just 7 years into the future and we've gone up to Jupiter. And just for some scale comparison, that's about 315 times the size of Earth. And if you're curious, just like I was, on how long is it until we get to the largest body in our solar system, the sun, that would be 2093. So in less time since we set foot on the moon, AI will have the compute potential of the sun. And that'll be an interesting energy problem, number one. But when I look at young people like in the front here, and I know the potential that's coming of the compute, and I've come recently to understand the potential of what they have to solve when we give them some new tools to solve the new problems instead of the old tools to solve the new problems, it's pretty incredible. And I probably wouldn't be here talking with you if I weren't so inspired. So not only is there this planetary size of potential, we have some ways to bring people to the fold that just weren't possible before. And I think redefining possible for ourselves, strangely enough, through conversation with technology, might be how we start changing the outcome in a way that has a lot of beautiful unexpected to it.
Nice metaphor there, Sarah.
Yeah, that was beautiful. I agree. And I would say, your comments and Sean's comments reinforce something that I feel most days, which is a real fuel under my feet. Innovation requires speed. And the people who become fluent with new technologies are able to bridge the competitive gaps in their local economies, are able to come together across disciplines to take advantage of new technologies and solve problems with them. They will accrue the value of those technologies. And of everything Sean said, the only thing that sent shivers up my spine is the idea that healthcare will be governed by Instacart and Uber. And it's not because they don't have, those are companies who deserve the right to go after business opportunities. But, I'm sitting in a room with the CEOs of Highlands Oncology and Community Clinic, and I'm thinking these people have devoted their careers, their lives to working with real people and solving problems in real communities. And they know what healthcare is. They know the industry, they know the people they are driven to solve the problems. And those are the people that we need to equip with the talent and the technologies and the resources to build here for the people that they know and they care about. So I feel a real sense of urgency to tackle this in this state.
Thanks, Sarah. And it goes to the point that Sean made about having those partners, and getting the right partners is pretty key there so that it doesn't go astray, right? I think we stayed a good bit aspirational there, but I do want to go to his comment about if we do it right, because I've heard probably one of his colleagues say we've got about a 50-50 shot of getting it right. And I think our congressional leaders are also seeing the potential here. And just earlier this week, the White House issued an executive order to try to get some standards and testing for AI, sharing the testing information with the federal government, protection against engineering of biological materials, protecting people from fraud and deception, the deep fake stuff, increasing cybersecurity. So my question of you is, what do you see as some of the biggest risks with the new technologies as we become more reliant upon them?
I've got one real quick.
Yeah.
I'd mentioned, conversation is code. I think there's right now, it's seen as a technology, and that is, sometimes that implies a certain level of technical acumen required to participate. And right now, there are terms like prompt engineer and prompt architect. And that makes these things seem like, well, it sounds like I need to go to school. Actually, it's conversational composition. It's using the language that you know. It just so happens that when you have experience or specialization, you're able to use more articulate and accurate language, and what you are able to provide are more accurate terms and language that these language models and the math underneath them can now guess. So someone who's new, perhaps to the health industry, they're going to need maybe 6 or 7 tangential questions to get to about an 80% accuracy rate, but they can get there pretty quick and start comprehending and understanding, maybe even on a new topic. Someone who's been in the industry for 15, 20 years, two questions and they have a chart and a program and they've emailed it. Both are very useful, especially if they happen to be working together. So I think some of the barrier is going to be just adjusting the language, and what Ryan was talking about, I don't know what that is, to include kind of demystifying, almost anthropomorphizing what this really is and what the roles that are possible that people can play, and helping bridge people in. So like, I don't think I'm not an AI expert. I didn't go to college, but for like half a year, and then the system just wasn't built for people like me. I just self-taught, and then I was done with it, and I'm like, okay, well, I can't pay attention to this anymore, so I didn't. So it's like a self-education process that is actually very, very possible now. In fact, we have these tool sets where if I make a lesson plan, perhaps, I can now use this mechanism to translate it to the needs of 140 students in an afternoon because I ask it to. And as long as that pattern has been established, it can be in any language. It can adjust to children with special needs. And as soon as I have that pattern established, I don't have to change that throughout the year other than observations that are being made. And then now perhaps the language coming back to the teacher is also translated in a more personal way that can be understood. And now we can communicate and teach each other. And what would that mean? I don't know, but I'm sure hoping we find out.
Yeah, I think you're a technology optimist, and I am too. So I
even as a cybersecurity guy.
Yeah.
Trust me, I'm sitting up here and go, he said the risk word. I'm like, oh, I have got thoughts.
I would say.
But I want to be positive first.
Yeah, I mean, I started my career in molecular biology, and I was working in genetics specifically, and this was on the cusp of the genomics revolution. It was before it had happened, but I lived through the 5 years before and the 5 years after. And at the time, and I was at Princeton, and my PI in my lab, he was so obsessed with the risks of what genomics would allow that he left the lab and he went to the School of Public Policy and started writing books and touring to talk about the risk of designer babies and all these things. That was in 1999, that was a long time ago. And, we haven't really seen that come to bear. And I would say that we've seen a lot of personalized medicine, a lot of treatments, a lot of good come to bear out of that revolution. Where we are in AI reminds me a lot of where we were in blockchain 7 years ago. And this is where my fear comes in. So blockchain was a technology that held a similar degree of promise, and it still does. But in the US, we have talked ourselves in circles and created a mess of a regulatory environment that has impeded innovation, and other countries have won. And it's going to be really hard for us to catch up in that space. And that could happen in AI too. And it's not that I care so much about what other countries winning over the US. I want communities to win, and for the regulatory environment to not impede and scare the healthcare systems that are very risk averse away from technologies that could improve efficiency, that could serve rural communities, that could help their clinicians save time, that could retain their nurses. So I think people in healthcare need to be really, really engaged in policy. And ACI is an organization that does this better than almost anyone else. And I so am grateful that they are here. But it's the obligation of all of us to really think through the policy issues and think through the regulatory environment that could advance or stick AI in the mud.
I would add one point, because I do get excited about enhancements to business processes and streamlining things. And, you could ask my team, we're talking about this kind of stuff all the time. How do you reduce friction in this process? That's all wonderful things. I think the risk and the reality is there's a lot of money to be earned in technology and in adopting these processes, adopting AI to move things forward. If we put the dollar ahead of serving a patient's needs, or the person's ability to deliver quality health care, we risk the outcomes we risk, which has broader implications to a healthy society. Not only do the policies have to be in place, but I think there is this part that's a little harder to govern. We cannot go all into this and let it happen to people. We need to bring the people along. So how do we balance the mighty dollar? I mean, we're all in this economic environment together. Right now, we're all feeling the pressures of what's happening.
Yeah, it really goes to the traditional iron triangle of healthcare, which is access, cost, and quality, and there are trade-offs, right?
Yes, and I don't want to be the pessimist. I'm not trying to be the pessimist. I mean, that's the reality of where we are.
I'll help you with that probably in a minute.
You okay, Zak?
Ryan, you want to chime in here?
And to Carol's point, if you put the patient in the center of this, and you go outside this room and you go to rural Arkansas, I mean, this will be a real challenge for some of our patients to adapt this technology. If you implement it in our hospital systems, it's not free. And so there's a price tag for Judd or Shannon, as you called out, to implement this into their system that may or may not be budgeted for. And so while there is a hefty price that the producer will make, it's not the hospital that's making this. It's them spending it to acquire this technology and then force feeding it to their patients who may or may not adapt to it or adopt it and may or may not understand it. And there we will create a larger divide between the haves and have-nots as we look to exclude an entire section of our population that can't afford this technology. And so I think that's an issue that we're going down, or a path, if you will, is this race to technology and AI. The other piece, and we may talk about it later, is reimbursement. I mean, our payers are not reimbursing for this technology. And so if using the Coke model, the Coke was bundled in your purchase price of your meal, right? If your Coke product was separate, would you purchase that out of your pocket? Maybe not, right? And that's what we may get to, asking you to purchase separately this advanced care from an AI technology standpoint that Ryan can't afford. And so now we're force ranking who can and who can't have the best health care, which I think is a bad path to go down. And to go back a question, and to Carol's comment about educating, just to kind of call out, and Dr. Jones is here, and I'll use BHS specifically. These guys do a fantastic job educating, I'll say K through 12, but specifically the high school and the younger students that are coming out of not only about technology and AI, but what it is in healthcare and how it works, and then the adaptability and adoptability in healthcare. And so we are going down to the younger generations to enforce and teach, but also as they become the next leaders of tomorrow and they are sitting in these chairs, this has been their language their entire lives, and they'll be able to not be a late adopter or early adopter. It's normalized for them. And so that, I think, is extremely important. And I applaud you, Dr. Jones, and what you guys are doing, and all of the educators.
Great. I want to apologize up front. I am an attorney, so my job is to identify and mitigate risk. So, all right. I want to remind you that you can submit questions here if you have any for the panelists. I've got a couple more, and then I do want to open it up to you guys, or if I see a really good one, I might jump on that first. I really want this, for the most part, to be a reaction to what Sean had to tell us, but I do want you to share one development in healthcare that you didn't hear discussed, that you and your organization are closely watching here in Arkansas going forward.
And I think Sarah probably best answer this, but one thing that was mentioned that we actually do have, and I think it's promoting awareness, but he called the electronic medical record, and if he comes here and back his home state and it doesn't transfer, the state of Arkansas actually has a program called Arkansas Share that is a health information exchange that does just exactly that. And so if I'm sick here and I go to Fayetteville, or if I go to Little Rock, my information follows me. Hospitals have to be participating in this program, but we, to have out that we need to do X, Y, and Z, it can be right, but we also need to understand what we have now and not try to solve for something that the answer already exists, and then we're spinning our wheels and replicating our time and money on something that's already there.
Sure.
Yeah, well, it's hard to find anything profound to say that Sean did not already touch on, but we did not, to Carol's point, we did not talk about economics much, and I'd say an observation I have is from across my 25-year career is I have seen these waves of change in different sectors that drive the sectors away from like a systems way of thinking toward a human-centric way of thinking. So an example of this would be Howard Hughes Medical Institute. Are you familiar with HHMI? Anybody here? People who are fundamental researchers know them because it's one of the world's deepest philanthropies. They invest in biomedical research, but at a fundamental level. And they reinvented their model 50 years ago or so to have this sort of motto of people, not projects. So instead of funding research based on the hypotheses you're testing and the studies and papers you're going to publish, they started investing in people who were really bold and had really big, difficult questions and were willing to risk their careers to answer these really, really difficult questions. And they would give them a ton of money and a ton of freedom and say, go, come back to us in 5 years. And that model has worked. They have more Nobel laureates in their ranks than any other organization in the world. Their scientists have invented CRISPR and new forms of oncology treatment, all kinds of things. So that human-centric thing happened in science. Then, of course, the human-centered design methodology started to really influence the entrepreneurial community. This is the space I live in now. And this was a huge, earthquake-sized seismic shift in how people think about building businesses and products, away from, I've got this dream of having a bookstore one day, to I'm going to forget what tools I have available to me. I'm going to forget what business I'm going to have. I'm going to think about that human being whose problem I care about and understand who they are and be completely agnostic about what technologies I use to solve it. And Stanford's biodesign program is the best program in the world with this methodology in healthcare. And we have a biodesign program in Arkansas led by Health Tech Arkansas. I see Jeff and Haley in the room today that has pulled together partners to create human-focused innovation. It's very powerful. Where I have not seen that change, but I'm starting to see some signals of it, is in the venture capital world. Venture capital still works the way it always has worked for the most part, with all the money concentrated on the West Coast and the East Coast, and very few dollars coming to places like Arkansas. But there are these new models emerging. An example would be the Cystic Fibrosis Foundation. If you know how they have engaged the parents of kids who for decades had no available treatment for this life-threatening, horrible condition that their kids had. They pooled their money, they invested as investors in an early-stage drug company that ultimately had a windfall drug. All of that money then went into the Cystic Fibrosis Foundation, is being now reinvested into new advanced treatments. That's a really weird way for venture capital to work, but it absolutely did work because it was focused on the needs of people. And I think VC needs a huge earthquake moment, the way that human-centered design gave entrepreneurs. And it hasn't happened yet, but that's what I'm tracking.
Yeah, I won't pretend that I'm from inside the health industry, so we'll start from there. This is some outside looking in stuff, but some of the themes, that came up around retention and then of course, fast tracking certain forms of education so we can get people involved in certain ways. And I think, from a perspective of upskilling or retaining, especially with these new tools where now people might on resumes start looking for, even around healthcare workers having some kind of AI competency or AI literacy, how do they even get involved and participate in this? And are they now going to prioritize people who have that little checkbox over people who might have lots of experience and are really good interpersonally already, but you don't have this checkbox. So I'm sorry, what we're going to do is get rid of 5 of those people and pull in 1 person who has an AI checkbox, and that must mean that they can do the same thing. I would challenge them or try to convince them to keep those people, pull in the tools and upskill them so that they force multiply. And instead of a 5-year roadmap, they do that 5-year roadmap in 1. And then on the other side of that, on the cybersecurity side, we have a whole new classification of risks that, to Ryan's point, we don't even quite have the words for yet. And yet here we are trying to figure out how to plug it in as fast as possible. So when we take our David Beckham experience, there's something called a man-in-the-middle attack. It's just where someone from point A to point B wedges themselves into point A.5, and you don't know it. So that might just be to sniff, hey, I want to see what you're up to. I'm observing your conversation and you don't know it. It could also be to manipulate that conversation. And so if they're able to hijack or inject themselves into a generative AI health conversation and they don't realize that that signal is publicly exposed, I can now manipulate what David Beckham is saying. And if you're having a health conversation and I'm just doing text, I'm not doing a 3D generated model. I'm just typing in, I'm replacing what words David was supposed to say, whose mouth says it. And right now, I think we have a very fragile trust that we have to take care of. And that's going to be very difficult because it's a bit ineffable in just as the people who are creating these tool sets aren't even quite 100% sure what else is possible, I do know what's possible in terms of possible damage if David says the wrong thing in the wrong order, because someone from another country who could be 15 and just kind of messing around doesn't understand the implications on the other side, or even worse, absolutely does. And then what do we lose? I don't know if we can even calculate that right now, but I think it's something that we need to be ambiently thinking of and part of our ideation process as we keep going.
Yeah, it's important because trust is such a critical part of the healthcare system.
Sure. And then the new tech that we know is helpful and need to get out there. But speaking of familiarity, my family's from Cornerville, Arkansas. It was only recently that they got a zip code. They had to go to Star City, Arkansas to go to mail. I can tell you, even with me, if I came down there and said, check out this new healthcare bot I made, they're going to be like, I don't think so. So I think we need to also make sure that when we're talking about outreach and familiarity, that we are tuning that in a phased, thoughtful approach to allow them to onboard, and so that when those moments come that they could be taking advantage of this right in their pocket right now and don't even know it, that it's something that they are trusting a bit more because they're a little bit more familiar, and maybe it uses a little more of their dialect.
Yeah.
Yeah. I think I would only add, again, from the perspective of the Upskill NWA's participant and within the scope of what we do, the credentialing, Zak, as you said, very important to me. The value of that micro-credential or stackable credential, if you will, to put the person at a higher, maybe give them a better chance at an even higher wage job. I think that would be great. I think, at a policy level, when I look at things being done the way they're always done, I'm always concerned about this barrier that exists. And, I'll give you an example of something that happened to one of our participants. So they recognized they had a criminal background, and it wasn't a felony. So it was a criminal background. And they wanted to apply to the registered nurse program. And so they asked us during their interview, hey, if I had this thing, can I still sit for the NCLEX? Can I still sit for the exam? Is there somebody I can talk to? So we went back to the college and said, hey, director, this is the situation we have. Can this person sit for the exam? And the director said, I don't know. They've got to decide if they're willing to make an exception. Okay, well, who do we need to talk to so that we can have this conversation? Like, who is it that I can direct them to? Oh, you can't do that. That is only done at the time that you apply to the NCLEX. Oh, so you want this person to complete prereqs, apply for a registered nurse program, complete the registered nurse track, and when they go to take their certification exam, which they have to practice being a nurse, find out if they can sit and take the exam. Yeah, because that's the way it's always done. I'm concerned about that. So just in relationship to what we've talked about here, the technology, I think I've already said, let it happen with us. Let us be a part of the journey. Let us work it into our curricula. Let us put it into our clinical slots. Let us all move along in that, so then we can have greater adoption, so that we can have greater efficiency, so then we can all see how we fit into the picture of healthcare, or the future of healthcare in Arkansas.
Some unnecessary barriers sometimes.
Yes.
It's a good question here. If you could wave a magic wand and put all the time and resources that you could over the next 10 years to improve the health of Arkansans, whether that's using technology or not, where would you put that time and effort?
I can start. Say some could be technology based or not, but my buckets, if you will, child and family services, mental health, behavioral health is the second, and then rural health / connectivity. And so if we can reach the child in his or her home at an early age and hopefully keep them in the home if it's safe, if it's not, have a transition plan, but probably 10 out of 10, maybe 9 out of 10, that individual grows up and it's not good, right? And so a not good individual is not going to get better most of the time. And so if we could fix that, I think it could mean a lot and move a lot. Mental health, and Laura's here with us from Marissa, can speak to this, but providing mental health services, behavioral health services, the same thing. If you're in a bad spot, and we've all been there, right, to speak up and ask for help, but having help available at the state level and access to help, and then in rural Arkansas. And so if I don't have a zip code, maybe I don't have the internet, right? And if I don't have that, I can't go to my Instacart and I can't get food or my diabetes medicine or something. And so that lack of connectivity cuts me off from the outside world, which will then go back to, my mental health awareness and loneliness and isolation. And it could trigger a whole host of things. So those would be my 3 pillars if I had a magic wand.
Can we please get this man a magic wand?
Done.
Stat. I'm going to suggest something that I actually don't think takes a magic wand, and I think it will happen. It's just a question of how fast, which is, I really do get depressed sometimes about how few private investment dollars come into the state of Arkansas for healthcare. It's depressing. It's, in 2022, a total of $270 million of venture capital came into Arkansas, and only $30 million of that was for healthcare and medical innovation. It's a really low number because it takes a lot of money to do anything big in healthcare, as you all know. However, what we have that they do not have in Silicon Valley or in Boston is the most unique ecosystem in the world for healthcare. And I think you all know this. You see it every day. We have an incredible community of healthcare organizations that in other places would be competitors with each other, but they are willing to work together. We have one of the best healthcare accelerator models in the world in Health Tech Arkansas and what Jeff Stinson has built. We have the world's largest company that has invested and will be investing significantly more over the coming years in healthcare access in rural places. And we have a deep philanthropic commitment in this state to whole health. Those assets put together toward a common purpose are so unique. And if I had a magic wand, I would get all the people at the table and have the most brilliant diagrammer give us the Venn diagram so that we could figure out the things that we have in common and go after those things. That's hard because those sectors are very different culturally and the people are different. It's hard to work together because there are some differences. But that's the promise of this place, and I just am so excited about it.
And are we working on that today, or?
Yeah, let's do it.
Good deal. That's the reception, by the way. Yeah.
Okay, I can roll with one of my favorite quotes. It's magic is desire made real. And I think if I would put into what I would desire, it would be to be understood. And if we're talking about loneliness, oftentimes loneliness is less about company and just feeling understood. And particularly on the medical front, and I kind of had this discussion in our last presentation, had an experience that also kind of propelled me to share a lot of what's going on this AI front with my wife. We've been in a process of going through applying to the Mayo Clinic, and that was a scenario that was very daunting. And we knew we were going to get a blitz of labs and questions from this interdisciplinary office, and we didn't know from the 7-sided punch of what do we even need to know and how do you prepare, and oh goodness gracious. She was quite intimidated by it. So I already done some tinkering, and while we were making spaghetti with no program at all, I didn't touch the keyboard, I was just speaking, I used a mic. I was able to provide a chat GPT session with her symptoms. I loaded in from Quest her lab diagnosis. I let them know, here's exactly the situation. And what I want you to do is make a diagnosis table of most likely. And then after that, I want you to simulate the panel of Mayo specialists most likely to be assigned to our case. And I want you to give her an interview. Also, she hasn't had that great of experience with medical professionals so far. There's not been a lot of empathy, and they haven't seemed to understand what we're going through over a course of a couple years. So here's what her Enneagram is. Here's what her Myers-Briggs is. And also, she's Hufflepuff. By the end of the conversation, she was crying, not from a lack of understanding, but because she felt seen, she felt understood. We didn't feel quite so alone, and we felt more prepared. And it turns out that because of the way these systems are designed, they can actually emulate empathy and understanding a little better than people can either fake it or sustain it. And at any point in time now, I can go back and have a conversation with that panel. And actually we got rejected by the Mayo the first time. So now we're going to pivot over to Cleveland. But I just started a new conversation. I literally pointed it at the link of the old conversation to get it up to speed. And now we're preparing for the Cleveland clinic, but we're not afraid. We feel like I've got a team with me now. She feels understood, and we are comfortable in a process that I think a lot of people aren't so comfortable. And right now I could share that same conversational link with you as a template as we would anything else. You could pick it up and have a conversation with the panel that we generated, and it's in your pocket already. I think that's a powerful thing to understand. And the more people that know in a meaningful way, however we get to them, might be a way that we start making a difference beyond a personal conversation.
Yeah, it's interesting how these technologies are being used for companionship, and out in the nursing home space, and
oh, absolutely, especially
other spaces. And so
Substance
I
recovery.
definitely volunteer for the first course with Zak. That is inspiring. Zak, that is inspiring. I've had a magic wand. I would find a cure for endometrial cancer. My mother was not a survivor, so that's very important. I think, it's more aspirational for me. If there was a magic wand, I would put us all in a room together to build the systems that we need to get to things faster. I have found, just through my own work at Upskill, that we can do more together. And if you happen to follow me on LinkedIn, please do.
that's a plug.
Right, yeah. You'll see that I say better together because this is why. Our mission to connect people to their dream career, it sounds pretty simple. But when you break it down to what the life cycle of that person is and what are the interjections that have to happen across that life cycle so that they feel like they're the best version of themselves so that they can get a career that has upward mobility or a chance at upward mobility, it becomes a little more difficult. Through our employer partners, we find out that financial literacy is a big need for this group. We know leadership skills. This is a registered nurse that will eventually, hopefully, become a director of nursing. And there's some leadership skills that maybe they didn't get while they were in school. We also know that they need to be well prepared to be interviewed by those hospital partners. So this whole interviewing skills, ability to interview well and present themselves well and tell their stories well is also a need. Well, anybody, I could take some canned thing and I would tell you my history. I was leading the design and development of all functional leadership training for our U.S. workforce in the company that I worked with before. I could design this interview skills training, but I can't do it as well as Dress for Success Northwest Arkansas does it. And I can't do financial literacy training as well as Credit Counselors of Arkansas does it. But I can help create the best version of that person by giving them access to CCOA and giving them access to Dress for Success Northwest Arkansas. We can do better together. So if we all got in and figured out a way that each of us could take our parts and connect them, we could do this together, but we're so busy because the success of Upskill is defined, and the future of Upskill is defined by how many people want to fund Upskill NWA. So maybe that didn't leave me a whole lot of time to be working on this other stuff.
Yeah, I want to leave it there. I think one of the great things about these new technologies is they carry the promise for connectivity to those services. And we've got to make sure that we're not, as Ryan mentioned, we're making the gap bigger between those who are advantaged and those who are disadvantaged. And we got to keep closing that gap and keep an eye on it. So, Ryan, Sarah, Zak, Carol, thank you so much. Give them a hand.
Yeah, Foster.